On the front lines of a pandemic that promises to only get worse, America's hospitals are already straining. In hard-hit Washington state, Providence Regional Medical Center Everett has seen double-digit cases of coronavirus. The medical director worries about what's coming.
What do we do if we have a limited number of ventilators and more patients than ventilators available? What do we do if we have more patients than beds available?
Nationwide, the U.S. has just 46,000 ICU beds, but a report suggests at least 200,000 people could need ICU care, perhaps many more. Hospitals have 160,000 respirators on hand, but a pandemic like 1918 could require more than 742,000. Already, hospitals are reporting shortages of masks and protective clothing. The country's EMS system is also bracing for a surge in coronavirus calls. There are 21,000 EMS systems in the country. 60% of their calls are basic first aid. But when a patient is struggling to breathe, it becomes a priority.
The dispatcher is telling us that this patient does have a cough and does have a fever.
Every Montgomery County, Maryland fire unit now carries an infectious disease bag with masks and face shields. The department is still waiting on 5,000 professional N95 masks it ordered in January. To conserve, firefighters were today told they should use the same mask all shift.
Take them off, place them in a paper bag, reuse them for the next person during their shift.
In Korea and Italy, the military has been called in to disinfect homes and check cars. An emergency move with a global healthcare system under stress. Tom Costello, NBC News, Rockville, Maryland.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.